Does it say recording?
Mm-hmm.
Okay. So this is our interview of a school-based occupational therapist, and we interviewed Terry Beard. So Terry is an occupational therapist who works in early intervention, and she works in Maryland. She works with kids from birth through kindergarten, and she provides services in the home, in the preschool setting, and at a clinic. She provides a lot of family-based services, and instead of primarily working with an IEP, she works with an IFSP, which is an individual family service plan. This plan is typically for children who are aged 0 to 3, but in Maryland, it can be extended past the age of 4. And some of the things that she does is work with parents and teachers for education, and she also does things like establishing hand dominance, working on grasp patterns, and fine motor activities. She said that she used a parent coaching model frequently because she may only see the child for a few hours each month, and she wants the parents to be able to carry this over at home. She said that parents are usually more educated or more motivated in this population, and it's easier to educate them because teachers are sometimes too overwhelmed to incorporate strategies into their classroom. So this approach is supported by Weatherby et al., who found that individualized parent coaching can increase daily living skills, communication skills, and social skills among toddlers. And then in regard to collaboration, Terry's team consists of herself, an SLP, a nurse, a general educator, and a hearing specialist. They used to have face-to-face meetings every week to discuss client progress, but they're now online because of COVID. So when working in the preschool setting, it's common for the OT, PT, and SLP to establish centers within the classrooms that she's at, and they have the children rotate through each of these centers in small groups, so that gives them the chance to see all 3 related service providers. And in a study by Orentlicker et al., it was found that over 97% of participants believed that collaboration was important in a school setting, and collaboration was associated with positive outcomes for the children, less parent complaints, and more team-based IEP goals.
As far as her collaboration with teachers and where she provides her services, she said that there was a strong community partnership, especially with early intervention. During early intervention, the most communication takes place with the primary doctors and nurses who have referred the clients to OT. A lot of the clients that she works with are in preschool programs, so there's often collaboration with the teachers of those preschool programs. But outside of early intervention programs, she collaborates with the health department, the Head Start program, and nutritionist. And this is connected through the Bradley et al. 2020. And then looking at where she provides services, she said that they did it both in the classroom and outside of the classroom. And then from preschool to 3rd grade, a more inclusive approach is taken. But once the child gets to 3rd grade, there's more pullout from the classroom, which is typically seen because it can become disruptive when there are multiple adults in a single classroom because they all have different objectives and goals. And so they're all instructing in different ways. For example, like if an OT has been working with a child on handwriting up into 3rd grade, then there are observable delays, then a decision needs to be made at that point that it's in the best interest of the client. Providing services outside of the classroom is not a quick decision, and this kind of connects back to my first question of collaboration. So it's not just her who makes this final decision of whether they should be pulled out of the classroom or not.
Okay, so they've touched on this a little bit, but some of the changes from COVID, one of the main things she mentioned was just that there were virtual meetings now instead of face-to-face meetings to discuss patient progress, and then school also starts later this year, so the teaching staff returned October 5th, and then the rest of the students just recently came back in a hybrid model on October 19th. And like Rachel mentioned, she serves birth to 5-year-old children, and she mentioned that sometimes it's hard, like for example, to get a 2-year-old to sit at the computer, so a lot of her services include a pre-planning session with the parent to find out what their goals for the session and the child are. And she still tries to maintain that natural and inclusive environment. But since COVID, pretty much all of the families have chosen primary service provider models, even those with an IEP, which she mentioned that had also changed since COVID. Instead of an IEP, they're looking at an ICLP, which is an individual continuity learning plan, and services are reduced to what the parents can handle. So they implement the services, and then Terry would coach them from the computer. So they may have been working on toileting before, but that had to be put on hold because of the virtual requirement. And then that was supported by Avendano and Cho, and it says parent implementation of intervention at home has shown to be associated with better maintenance and generalization of skills from therapy settings to the home environment. And then the last thing we asked her was just some advice that she had for us. One of the big things she said was to be mindful that we would work under that primary service provider model and support a wide range of developmental needs, which would eventually move more towards academic services, and that'd be based more in the school setting. And that was supported by Erickson. And it said, our job as school-based therapists is to move towards a vision of client-centered, occupation-based practice. Change is complex and collaboration is key. So that was another one of the things she touched on, just to collaborate with others, find a good mentor. And one of the most important things that I think I learned from her was just to be confident in your ability as a provider, and just find that good mentor to help you solidify your skills and kind of give you an example of how to communicate well with the clients.
So just overall, to kind of wrap back to class, as we kind of talked about, it's just really important to be flexible in a school setting, especially with things like COVID. You never know what's going to happen, and you might have to change your intervention. So that was one of the key things that she shared. And also collaboration with parents, teachers, and other related service providers is crucial. And especially in this early intervention setting, she talked about collaboration with parents and how it's so important to get them to be on board with what you're doing.
And then also it's important to know the laws and regulation of your state, because every state is different. And so you want to be aware of what you were able to do. And then just lastly, it's just very rewarding to see a child's progress.
And here are our references.